Coming up today, one woman's unexpected diagnosis leads to another. Today, we'll meet the mother-daughter duo who are using the same dream team for their treatment and care. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. Like mother, like daughter, Mary Bennett and her daughter Acacia have more in common than the average parent and child. They both have a life-threatening condition. While their diagnosis is different, their care team is the same, helping them get their life back.
I just kept reassuring them that I wasn't going anywhere and that we would get through this.
Mary Bennett shares what it was like breaking the news to her 4 children that she has cancer.
It's okay.
Her daughter, Acacia, still has a tough time with it.
It was terrible. Mom is like my best friend, so really bad.
Her mom was diagnosed with acute myelogenous leukemia and underwent a stem cell transplant at the University of Kansas Cancer Center.
It's curable, which was, definitely a light at the end of the tunnel. Once I heard that, it flipped in my brain and okay, I can do this, I can get through this.
She got through it the first time, but after chemo and that bone marrow transplant, the cancer was back.
I got the call from Dr. Bonzal that I had for sure relapsed and the cancer was back.
But for Mary, the worst was yet to come.
I was sick at the very end of December in 2021.
So what do you think of this one?
In the midst of her mom awaiting yet another bone marrow transplant, Acacia was diagnosed with aplastic anemia and would ultimately turn to the same team at the cancer center treating Mary.
Pretty much everything that they do for me is the same with Mom. The only difference for me is I didn't have to go through chemo, and I was potentially going to have a bone marrow transplant.
It was awful watching her go through. I told my sister, I said, it's way worse watching somebody go through this than going through it yourself.
Both mom and daughter are doing better.
Being creative has always been a great escape for me.
Both still battling the effects of their diagnosis and looking forward to better days.
I'm super grateful right now, for sure, but just there's still some more to do.
A lot more to do. And Mary and Acacia are here to share more of their story. Ladies, good morning.
Good morning.
Good to see you both. Dr. McGurk is also here with us. He is the Division Director of Hematologic Malignancies and Cellular Therapeutics, also the Medical Director of Blood and Bone Marrow Transplant. So good to see you.
Good to see you as well, Jess.
Always. And then also back with us is oncopsychologist Dr. Elizabeth Monks, who will discuss the mental aspect of facing a life-threatening diagnosis like we're talking about today. So good to see you, Dr. Monks.
You too.
Mary and Acacia, just we're going to start with you. Tell us how you're doing. Update us on life and where you are with your treatment and recovery.
Acacia, do you want to go first?
So basically, I'm kind of at the end of the tunnel. There's still recovering to do, but more just, daily oral meds, monthly checkups, but definitely doing a lot better than before, not having to get any blood transfusions, platelet transfusions. Haven't been in the hospital in a long time, so doing a lot better.
Mary?
Yeah, I actually am thrilled to say that I am, my counts are all up. I'm 100% my donor. No signs of graft versus host disease. I am still due to medication to prevent graft versus host disease, having some issues with AVN in my hips and shoulders and some issues with my back. I have osteoporosis now, but looking to get some surgeries to fix those issues. So I couldn't be happier. I mean, it's such a blessing that I'm not dealing with anything else on top of that, that I am cancer-free. And now it's just getting through these surgeries and hopefully getting back to, life.
Mary, the only thing worse than going through this yourself is to watch your child go through a similar type of diagnosis. What was that like for you? How did you prepare for that, help her, but also while you're going through your the same type of health issues?
I don't think you can prepare for it. When I relapsed, I was really feeling sorry for myself and um, pretty depressed. And when I found out about Acacia, everything changed. It was, doing whatever I needed to do to be there for her. And she was amazing throughout the entire experience. I couldn't believe how strong she was. She went through some pretty invasive testing that I didn't have to go through when she was in the hospital for a month after her ATGAM. So, I mean, she gave me strength.
Acacia, you're being your mom's support through her illness, and then this happens to you. You're facing this similar route. What was going through your mind? How did you tackle that?
At first, I was kind of in complete panic. Obviously, just seeing everything my mom had to go through was already like traumatizing. And then I was really freaked out before I knew what was going on. But once we figured out a plan, I was like really relieved, honestly, and just kind of ready to get better. And I knew it would be a long road ahead, but at least I knew what was going on.
I want to bring in Dr. Joseph McGurk. And Dr. McGurk, obviously it's great to see the ladies doing well, but truth be told, we have Mary who needed that second transplant. Acacia needed a bone, she had full bone marrow failure.
That's right.
Her entire immune system collapsed. This was very life-threatening. Kind of tell us what it was like, kind of in the throes with both of the ladies when you were treating them.
Absolutely. So Mary, extremely tight-knit family, an extremely supportive family, and she was going through her first transplant for acute leukemia. Her best chance of being cured was a transplant, and at the 2-year mark, the bone marrow came back and showed relapse disease, which is absolutely devastating, just horrific. She's such a lovely person. Not that anybody should have to experience this, but Mary did have to experience this. And so we needed to get her back into remission, which was a long shot, but it worked. And then we needed to get a second transplant, a second long shot. It worked. She's in complete remission. She's doing beautifully, as she just described to you. Now, during one of my visits with her, she told me, geez, my daughter is dealing with this problem with her liver and her blood counts are low. And she described it to me. I said, get me some more information. She did very quickly. I said, get her over here right now. She was at an outside institution. And what I was seeing suggested that she was probably having a terrible viral infection in her liver, and the immune system was attacking the virus to kill it, but it mistook her stem cells in her bone marrow for the virus and started attacking her own stem cells, wiped out her bone marrow, so she couldn't produce any blood, and her immune system was destroyed.
Aplastic anemia, that's what it's called?
That's correct, severe aplastic anemia.
So go back to Mary, though. Is that common or rare that this would come back, that she would need that second bone marrow transplant? And you said it was very dicey once.
Absolutely.
Once she needed the second one, you just didn't know which way this was going to go.
To be honest with you, it was a Hail Mary pass, and we talked about that. I was very frank with her that we were in a lot of trouble. Relapsing after bone marrow transplant is associated with extremely poor 1-year survival. Most of those patients don't survive beyond several weeks to a couple of months. So it was going to be a long shot for us, but she was a very determined lady. And she had a very positive attitude, and she was going to lick it. And so we were with her 100%. The whole team was behind her, and here we are today.
So she's like a case for the books.
Absolutely, she is.
That's fantastic.
It's miraculous.
So tell me about their treatment and how similar it was and what was different. Because, when I saw them and I realized that they had, I always think of you as treating blood cancers.
Yes.
And so when Acacia told me she did not actually have a blood cancer, I was like, but you went to Dr. McGurk. So I was trying to make the connection there. So help us understand that connection between both of their illnesses, and is there any type of genetic component, or is it just coincidence?
It appears that it's just coincidence. We looked for genetic components that would tie these things together because of the extraordinary coincidence that both should have life-threatening bone marrow disorders. One, acute myelogenous leukemia, the most common form of acute leukemia in adults, and the most potent potential curative therapy for acute myelogenous leukemia is a bone marrow stem cell transplant using somebody else as a donor, in this case, unrelated donor. And that has about a 50-55% chance of curing our patients. 45% though can die from complications of our transplant or relapse, and that was the case for Mary, of course. So she underwent then a peripheral blood stem cell transplant from an alternative donor once we got her back into complete remission. So very intensive chemotherapy. Now Acacia, on the other end, her bone marrow had failed because her immune system was attacking it. And so her therapy was different than traditional chemotherapy. It was a combination of therapies to suppress her own immune system to keep it from attacking the bone marrow, allow the bone marrow to recover and counteract the effects of that immune system, and then manipulate that immune system so it became normal again. And that's where we are now. She's almost off of all of her medications that suppress the immune system, and her blood counts are holding up very well. 50% of patients can relapse, and if they relapse, then we need to do a bone marrow transplant. So bone marrow transplant treats bone marrow disorders. Most of them are blood cancers, but not all of them. For example, in the case of Acacia.
So that's rare. A lot of this is rare. How rare is it to be treating a mother and a daughter at the same time, two different conditions? You said it was like out of the hall and down the hall, and seeing one to the other.
That's right. Sometimes we're in the rooms right next to each other.
Wow.
And so that's extraordinarily rare. But all we do are bone marrow transplants, stem cell transplants, CAR T-cell therapy. And so we see the rare of the rare. And we have had families come together with dual diagnosis of cancer. As a matter of fact, a young man came to me with lymphoma, and his twin brother was diagnosed 6 weeks later with the same lymphoma. And we treated both of them with bone marrow transplants. But these are exceedingly rare circumstances.
All right, so I know that Dr. McGurk thinks of your family quite fondly, ladies, but which one of you wants to share with him your nickname for him?
Go ahead, Case.
We like to call him the GOAT, the greatest of all time.
Well, what did you say you wanted to be called,
Dr. McDreamy, guys.
He wanted to be called Dr. McDreamy, so if we could work that in there somehow for him, that would make him very happy. But I think he'll take the GOAT.
I'll take it. Thank you. That's too much credit. It's a team effort, as you know.
Well, it just, Mary, why is he the GOAT for you and your family?
Oh gosh, there's so many reasons. Probably one of the biggest is his demeanor, and he's very straightforward and very honest with you about where you are in your journey and with your diagnosis. Like he said, I was very honest with her about that when she relapsed and what we were facing, what we were dealing with. And I just love the way that he interacted with Acacia. He made her feel safe and calm and gave her hope. And it's rare to find someone with his expertise. And I mean, just listening to him talk, I mean, you can tell just his brain and the way that it works, and it's just so amazing. And so to also have the bedside manner that he does, I mean, you couldn't ask for more.
I want to bring in Dr. Elizabeth Monks. Dr. McGurk handles the physical part of getting patients back to where they need to be, but you handle the mental aspect. What was your role in helping Mary and Acacia? And you're the one who actually brought this case to me, to my attention. And so, tell me about them as patients for you.
Mm-hmm. And it's definitely a team effort. I know I can't prescribe the chemotherapy, I can't do the stem cell transplants, but a working medical knowledge and a working knowledge of the emotional turmoil that these patients go through is definitely a joint effort. So while I may be in charge of sort of treating the emotional parts of this, I need the team, nurses, doctors, everyone's input to help these patients like push through. So I feel like I lead the charge on the emotional front, but I need the army essentially to get it done. We meet most patients before stem cell transplant to get an assessment of where they've been, what life experiences they've had, try to get ahead of anything that we might need to treat, like depression or anxiety. And I think with both Mary and Acacia, I had the opportunity to be able to see them in both settings, both an outpatient setting and when they were in the hospital. And those two experiences can be stressful in very different ways. The stressors of being admitted in the hospital for a long time, also the stressors of doing the outpatient part of things is really difficult. So I initially met Mary first, and I have to say, out of the gate, I was impressed at the resilience that was already at the foundation of Mary. She just encompassed knowing how to deal with life's hardest things, and we just had to sort of build on a foundation that was already there.
Yeah, that's being a woman and a mom of four and kind of a tough cookie. How crucial is she, though, in helping your patients?
Absolutely essential. As she was saying, we all do it together. It is completely a team approach, and if we're missing a critically important link, and that's really represents everybody on our team, we're in trouble. Our patients, therefore, are in trouble. That's a never happened circumstance. So Dr. Monks sees all of our patients, Dr. Monks and her team. She leads a team of psychologists and students, and it's essential for our team to have a better understanding of our patients so that we can contend with some of the challenges that they are faced with, in addition to the medical issues that they're faced with as well. So it's all comes together.
But quite a challenge, Dr. Monks, when you have two family members, both ill and both trying to be each other's support. How did you tackle that?
I mean, it was kind of fly by the seat of your pants. I mean, it's a lot of meeting patients exactly where they're at, and you know, to have a team that you trust. You want, I think Mary can probably speak to, this is the team I've come to put my life in their hands. I want that same whole team for my daughter as well. And the two of them are such incredible supports to each other. And so the big part of caregiving that's so critical with our patient population is the burnout that can come with caregiving for somebody who goes through a stem cell transplant, somebody who's dealing with a bone marrow disorder. And so they both were not only dealing with their own stuff, but also trying to be incredible supports for each other while holding their own stressors.
Acacia, how important was Dr. Monks in your journey, your recovery, and helping to get yourself better and support your mom?
Definitely very crucial. I struggle with anxiety pretty bad in the first place. And, you know, just having someone to explain to what was going on in my head and for them to completely understand and, you know, talk me through it was very, very helpful. And, you know, sometimes there were things I didn't want to say to mom because I knew she was stressed. And it was just nice to be able to tell someone, you know, this is how I feel, like if I was worried about my mom, you know, just things like that. And her just kind of giving me peace of mind and just, you know, understanding.
Mary, same question. How did Dr. Monks and your work with her, you know, impact your recovery and your relationship with your daughter?
Oh, gosh. From the get-go, I feel like Dr. Monks and I had a great connection. You know, as she said, I have always believed there's more than one way to heal, and I wanted to use, you know, every, you know, piece that I've learned over the years through just different modalities, and she was very open to working with me and, you know, me utilizing some of the tools that I had, like tapping and Reiki, and while also being open, you know, obviously to the amazing team at VMT. I mean, everybody there is just incredible. And I don't know, I feel like Acacia said, I kind of started tearing up when she said that there were things that she didn't want to say to me. And you know, I'm just so grateful that she had Dr. Monks to express how she was feeling and her fears. I mean, she's so brave, and, you know, to take that on at her age and to have somebody to share those things with. And, you know, I felt the same way. And I feel like the team was so amazing too in allowing me the time to be with her. And the timing and the way that they did things, they made sure that she was through at GAM and out of the hospital and doing well before I went into transplant.
Mary, you said that Acacia was brave. You were brave too, in my opinion, because you were really candid and open about your battle with alcohol before this happened. Tell us a little bit about where you are in your journey and maybe what your message might be for other people who are trying to kick an addiction and then they're faced with something like this. Where do you start? Where do you go?
Well, it was really interesting because I started not feeling great, and I, obviously no idea that it would, lead to the diagnosis that it did. And so I actually stopped drinking a year before I got diagnosed. And I also smoked, and I stopped smoking cigarettes probably about, I don't know, a couple months after that. It was difficult. It wasn't hard to stay sober through treatment because you get so sick and you just, that was the last thing on my mind. So that was not hard for me. But afterwards, you tell yourself stories, oh, I deserve this. I went through so much, whatever, you tell yourself to think that it's okay, to make it okay, to have a drink here and there and celebrating, and this time, so I did relapse, and it was very difficult for my children, and it was heartbreaking for me to let everyone down, essentially. But this time, Dr. Munson and I talked about some things that I could do after this transplant in order to not go back to the same creature comfort, so to speak, that I had before. And, I had mentioned just like being creative. And, I also work with people on a like human and spiritual development level, and that has helped me to help other people. So I don't know it, and also just talking about it, just being able to say I have this issue and I need help, and because that's the biggest thing, is the shame and the guilt that you carry, especially as a mom, when your children rely on you and look to you. And I mean, you want to be the best version of yourself that you can be, obviously for yourself, but for them too. And I think Dr. Monk's really helped me to achieve that this time, and to stay sober. And I want to, and I think that's a big part of it, is that you have to want to.
Thank you so much just for sharing that, and sharing your advice, finding new healthy outlets, and reaching out to healthcare providers and mental health care. So thank you so much for that. Be sure to ask your questions to our panel today by using the YouTube or Facebook chats. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's check in with Dr. Dana Hawkinson. Good morning.
Hi, good morning.
Hi.
So yeah, the COVID numbers, we talked about that. Just up a little bit yesterday. We had been at 14, 16, 19 active inpatients currently in the hospital. So creeping up slowly, unfortunately, but again, we do know that there is high circulation of the virus in the community. We know a lot of people that we know, friends, loved ones, are getting symptoms, getting actually diagnosed or not testing, but we know it is out there.
Okay, Doc, a couple quick things.
Yeah.
Local pharmacies are already starting to see COVID vaccine appointments. Any updates on when the health system will have updated shots available?
Yeah, hopefully in about a week or so we'll have those. We know that the health systems tend to get it a little bit later than those commercial pharmacies, but we will be getting those in, hopefully, like I said, within the next week, maybe 10 days, and then we'll be able to schedule that. We're also waiting for the RSV vaccine here at the health system, which should be in a little bit later than that, but mostly in the next week to 10 days, we are hoping for the COVID updated vaccine, and also, of course, influenza vaccine.
Let's talk West Nile virus real quick. It's spread, of course, by mosquitoes. Great reason to wear bug spray when you're outside. I always forget to do it.
Yeah.
But KDHE says that they've already seen 22 cases of West Nile this year, and even a handful of deaths. Your thoughts? What should we do?
Yeah, it's unfortunate. I think the thing about West Nile virus is it is preventable. Wearing that insect spray, especially with DEET, will help reduce the chance of you getting bit by a mosquito and it transferring the virus to you. The mosquito that causes it is the Culex mosquito. bites mostly from dusk to dawn in those nighttime periods. So it's very important to remember, if you are out walking or in the evening, wear your bug spray. And the thing is with this, Jessica, is that with West Nile virus, it's usually about 1 in 5 people will have any symptoms whatsoever. So most people don't even know they're infected. And then we did hear that you just talked about the deaths that occurred. So usually it is about 1 in 150 to 1 to 250 that actually get that encephalitis, which could lead to death. So just understanding that, we have to believe that there is much more virus infection out there. But luckily, most people do not have any symptoms, and if you do, it's mild. It's very rare that you will have those that encephalitis that could lead to death. So, but mostly protect yourself, wear your bug spray. Hopefully with the cooler temperatures, although obviously with climate change and the warming, it's going to be less likely, but with those cooler temperatures will help reduce the mosquito breeding as well. So.
Any reporters on the line today? Let's get to our community questions. Doc Hawk, let's stay with you. Ruth Ellen wants to know, how soon can one start vaccines after a shingles diagnosis?
I think you typically, for most things like that, I don't think there's any good data to support one thing or another. Really, if you want to wait a couple weeks, 2 weeks is fine. Certainly, after you have shingles, we usually want to wait until all of those lesions are healed, and then you can get the shingles vaccine. It is recommended to get the shingles vaccine even after you've had shingles to help prevent another recurrence. But any other vaccine, probably just wait a couple weeks. It's not really that long. Should not be too impactful on getting those vaccines. And remember, you can co-administer vaccines together if we were talking about influenza, RSV, most of the other vaccines as well.
And how soon after having COVID can you take the new vaccine? Jean wants to know.
Yeah, so I think what we're recommending now is that if you've had COVID recently, it's probably best to wait 3 months. There's probably going to be no benefit getting it before that time because your immune system is already going to be primed and boosted with that natural infection. So waiting that 3 months, especially if you are high risk, is probably going to be a good idea. So if you've had it recently, it's certainly okay to wait 3 months before getting that updated vaccine. That will then hopefully even boost that immune response going into the Christmas period and the holiday period during that time to help reduce your chance of further disease and hospitalization.
All right, let's get to some questions for our other guests, and this one is for Dr. McDreamy from Jeremy. He says, in your line of work, it sounds like you frequently need to have a lot of really difficult talks with people. What have you learned from that experiences? Just having those challenging discussions and kind of being able to kind of literally read the room on patient to patient.
Absolutely, so critically important, and it's always a learning process. You never reach perfection, obviously, and I think that most importantly, and Dr. Monks has emphasized this with us many times in our team meetings, listening to the patient and to their family and their perspectives, taking time, spending that time, and then helping them guide them through this process, and also let them know. I'm the tip of an iceberg of team members who will be helping support them. Our team psychologist, our nursing staff, of course, our social workers, our financial coordinators. There are so many pressures and stressors that our patients have to contend with in addition to their illness that they're contending with. And for us, our patients are always, it's a life and death situation for them. Increasingly, because of remarkable technologies and advances in a comprehensive cancer center such as ours, we're tackling these diseases successfully. But it's a complex process, and it takes a complex, large, multidisciplinary team to get them through.
Yeah, including the team that Dr. Monks brings to the table.
That's right.
Helping mind, body, and soul. Stuart wants to know, how can I donate bone marrow at KU? I guess we get on the registry first.
That's exactly right. Get on the registry, and 2 routes through the American Red Cross, contacting their office, or the National Marrow Donor Program, contacting them directly in Minneapolis, Minnesota. Our transplant coordinators are always glad to field any questions, so contacting the stem cell transplant program at University of Kansas Cancer Center is also another avenue to get information, to get into the registry. We need folks in the registry, particularly younger folks, 40 years of age and less, and folks from underrepresented populations such as African Americans, Hispanic Americans, Native Americans, mixed race couples. We need those folks in the registry.
Thank you for sharing that. Before we get to our final thoughts, Rachel just shared, I'm just so grateful for this program. 2 of my children had aplastic anemia and bone marrow transplants. She's highlighting both the challenges that everyone is having. So thank you. And of course, thank you, ladies, for sharing your story. I want to get our takeaways today. Dr. Monks, I want to start with you.
So I think the biggest takeaway is that, when you're dealing with cancer, especially these very complicated, complex cancers that require long treatments, long recoveries. I mean, as both Mary and Acacia can attest to, they're far out from their diagnoses and still working. So preparing for the marathon is critical, and taking care of the psychological and emotional parts as well as the physical. You have to do them both. And Acacia and Mary are great examples of 2 patients that put in incredible work, both on their spiritual and emotional and psychological sides, as well as, doing all the work that's required and all the sacrifice physically as well.
Acacia, what's the takeaway from your story?
I would say for me personally, just, now that I've gone through all these things, I just look at life a lot differently, and I'm just very grateful for, all the mental help and physical help. I wouldn't be here without it. So,
Mary, same question. What do you want folks to take away from your story?
Gosh, I would say just how important, as you said, each piece is, the physical, mental, spiritual, all the emotional aspect, everything, and how important it is to have family or friends or, supporting you. We wouldn't have gotten through this in the way that we did if it weren't for Acacia's siblings, her dad, my sister, her grandparents, my dad, just everyone, and even including the team. I remember when I started, Dr. Yacoub said, you have an army behind you. You're not alone in this. So, it's just phenomenal what not only our families brought to the table, but also what BNT and KU did.
Thank you, ladies, both for sharing your story. We really appreciate it. Dr. McGurk, I'm going to let you have the last word. What's the takeaway from today's talk?
It's all about family. It's all about the community and teamwork. As you've seen, we learn, if we do as Dr. Monks has instructed us, listen carefully, we learn a great deal and expand our horizons from each and every one of our patients. And Mary and Acacia's story and their experience, their journey, will reverberate through their communities, through their family and beyond, through their communities, and have a positive influence. And they themselves will make a positive differences in this world. So the work that we are privileged to do every day impacts our entire community. It's an incredibly sacred responsibility, and I feel fortunate to work with the best people that you can work with in this life on earth.
Thank you both for the work you do with our patients. Appreciate you both. Appreciate all of our guests today. Thanks to all of our viewers for being with us and asking your questions. We'll see you back here tomorrow at 8. Think COVID is in the rearview mirror? Think again. I'm Jessica Lovell on the next Open Mics with Dr. Stites, a live event with chief medical officers from across the region. Find out what we expect from COVID, the flu, and RSV this fall. That's Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.